colleagues who joined us a bit late. This was a 34-year-old Ugandan who was a support staff working at Wasungoi Health Center 2, somewhere in Mbale District, who had presented with all signs related to COVID, fever, dry cough, headache, and difficulty in breathing. And when her condition, that is since 15th July, and when her condition became worse, at that Wasungoi Health Center 2, where she was being treated for acute pneumonia, severe pneumonia, she was transferred to Joy Hospice Health Facility in Mbale District, where she was admitted in a female ward and passed on 21st July 2020, and was buried on 23rd using what we call safe and dignified burial, where the Ministry of Health together with the Red Cross take over the burial process and make sure that they do the burial by avoiding contamination to all the other relatives. But even the burial is really very restricted. We allow very few people, and they don't even get very close. And our people who do the burial are very well protected to undertake that burial. So you said, now that we have got this burial, are we ready for it? First of all, certainly it was something in the waiting. I don't think we are going to say that we are going to go through all this COVID period and expect no death at all. Certainly we knew a death will one day occur. Even the president said it, by the way. He said, you are going to see deaths, and these deaths are going to happen. You cannot go. I think God had helped us, and all the efforts we made as a country, and that's why we have reached 1,079 cases without a single death. So now we have got the death, but we anticipated the death would occur. As we told you, 20%, 15 to 20% of cases progress to severe and critical. And once you get to severe and critical, most often, most likely, you will lose a few of those who progress to severe and critical. So even as we knew at one point we'll lose some patients, and we've been prepared for that. That's why you see we have prepared ourselves to manage severe and critical cases by especially having all our regional referral hospitals prepared to manage severe and critical cases. So if you, that is even related to question number 5, that are you worried as a country that this is happening? Of course it's not, it worries us, it has happened. We were happy, we were going very well without any case, but it's something we knew would happen because it is inevitable that at one point it would happen. So we are ready for that. And then there was also a question that this is a perfect timing to relax restrictions or tighten them. Me, I think now the message is people were thinking that the COVID in Uganda is not killing. Now we have seen it is killing. So what is important now is to be very serious and very strict and make sure that we abide by all guidelines that are being provided, especially those people who are not serious with especially social distancing, washing their hands, and all the other preventive measures. So this is the time not to relax, but but to be even more serious with all those preventive methods which everybody has been singing about, including none other than His Excellency the President, all the preventive measures. And we request you as the press to help us to go and amplify those messages even more. Initially, we thought he was a Kenyan. Initially, you want to explain that? Initially, we were given information about that he was a Kenyan, but that's why we did. Yeah. Henry, you want to clarify that?
Yes, the initial information we had from the